Good afternoon, everybody. My name is Christian Franklin Roberts, and today I will be discussing a topic regarding strokes, and I'm going to talk about the variations of strokes, the treatments, the concept, and the whole mechanism of what occurs during the stroke and the causes and effects of it. So before I begin, I just want to kind of go over to the basic concept of the terminology of what a stroke really is. For according to my research, a stroke is basically sometimes called a brain attack, but it basically occurs when a blood clot is formed inside whatever parts of the brain, and a blood clot is formed, which is basically it's securing that broken blood vessel, but it's preventing the other red blood cells to flow properly because of the blood clot is being formed and built up. So we're about to go into the depths of that. Because that blood clot is formed, that's why the stroke occurs, and that's why it happens the way it happens. So we're about to begin to move on. I will talk about the two stroke types. I'm going to talk about this shortly. The most common stroke, which happens to 87% of patients, is the ischemic stroke. An ischemic stroke is known for the blockage of blood flow to the brain, like I mentioned a few seconds ago about the blood clot being formed. See, during an ischemic stroke, a blood clot is being formed because the blood vessel has been broken. So the blood clot is basically securing or basically kind of being the bandage of the blood vessel. And it's a good thing for a small moment, but after a while, it's going to start blocking the other red blood cells to go into where it needs to go inside the brain. So that's the ischemic form of stroke. Now, the hemorrhagic stroke is less common, but it's more severe, and it's 30% popular. It's 13% common according to patients. Now, the hemorrhagic stroke is more severe because the actual vessel is actually ruptured. It's so ruptured to the point that the blood clots can't even block it or can't even seal it back together. So because the blood vessel is ruptured, the red blood cells is basically pouring out. So it's pouring out all over the blood, which means that the basically the blood that's supposed to be going to certain parts of the brain is splitting out, which is causing internal bleeding. Which means that because it's causing internal bleeding, and then because a blood vessel is ruptured inside the brain, which is your nerves, you have a higher chance of basically dying. You have higher chance of risk life threatening versus the ischemic stroke. You have a higher chance of surviving, which is I'm pointing to right now. Like I just said before, a person ischemic stroke is I'm talking about ischemic versus hemorrhagic stroke. Ischemic stroke is when a person deals with an ischemic stroke is a blood clot that will block or reduce the flow of blood to the brain. The blood clot is basically the bandage of the broken blood vessel. But after a while, it has to kind of calm down and kind of revert back to the red blood cells and kind of continue to flow because the blood clot can block the flow. And the hemorrhagic stroke, like I said, the rupture of the blood vessel, it could lead to an aneurysm. That's why I said that it is more severe and it's rare, but it's more severe and it's more dangerous, more life threatening. So moving on, and this is just a diagram talking about the ischemic stroke. Sees the thrombus, which is the blood clot, and see how the blue areas, which is the deoxygenized blood. This is what happens when the blood vessel is basically broken, but it's fixable. That's what the blood clot is there for. But notice on this side with the hemorrhage, when you have a blood hemorrhage in your brain, the rupture, which means that the rupture, see, notice how big this rupture and the blood is pouring out. That's because the space in the brain is so big that that the platelets of the blood can't form together and actually basically secure that. So that's why, like I said, this is more dangerous. Now, moving on, we're going to talk about the symptoms of both ischemic and hemorrhagic strokes a little bit. See, both symptoms they are both numbness and have weakness on certain sides of the body, confusion, headaches, and seizures. Both strokes have those symptoms. Now, the ischemic stroke, they have more numbness, weakness as far as the face, arm, or leg, and often is mainly on one side of the body. And fun fact, I didn't mention this in the slide, but based on whatever side of your brain that you have the stroke, it affects certain parts of your body. Like for example, if you have a stroke on your right side of your brain, your speech is going to be most likely impaired and affected. But if it's on the left side of the brain, then your mobility is going to be affected, which means that part of your body might be paralyzed. And then as far as the hemorrhagic, it's kind of the same thing, but with the hemorrhagic, the worst part about it is the headache. The headache is severe and it's bad. And you will lose more of your balance and you will lose more consciousness every now and then. That's why it is, considered life threatening because it's ruptured versus the stroke and everything. But they both majority of the symptoms are very similar. So moving on. And see what I mentioned earlier, this is the formation of the blood clot steps when it comes to the stage of the clotting factor. And the clotting factor is basically when the blood vessels first broken. See how the platelets is starting to form up? That's because they're becoming the bandage of that broken blood vessel. And then the fiber mesh secure it and basically the icing on the cake. Basically that neosporin on top of that bump or that boil that you have. Yeah, it's that neosporin basically. So moving on. Then this is also another diagram talking about the dissolution of blood clots. When I say that, how I'm mentioning plasminogen is bound with fibrin, plasmin activation occurs, fibrin degradation, blood clot dissolutions, restoration of blood vessel flow. This is going into the details and the depths of what happens when the tPA first comes in. And tPA is what I'm about to talk about you in the next now. And there's this solution, which is this cure, basically for people who have stroke. There is this treatment that is very effective and that it works very well on people who dealt with strokes, not just people with strokes, people who are dealing with lung clots and some types of form of cancer. There's this thing called tPA, which is referred to a protein that converts plasminogen to plasmid while breaking down blood clot. So basically, tPA is basically a clot busting agent. So what it does is after a stroke occurs, the tPA is going to come in within a few hours after the stroke occurred. The tPA is going to come in and it's going to basically break down the blood clots just so the blood vessels and the blood vessels could be fixed and the red blood cells can flow again improperly. That's basically what the tPA is. It's taking down the blood clots, basically telling the blood clots, you've been there too long. You don't need to be there no more because you're taking up everybody's space and time. And fun fact, it's FDA certified. It's a trade name called Altiplace. So a lot of people who take the medication knows it as Altiplace. So moving on, see what I told you. This is oh, and another thing, tPA is an endothelium. It occurs in the endothelium cell. So basically, once that tPA is released, that tPA is going to bind with the plasminogen on the fibrins. Basically, the tPA is basically that kinase for the plasminogen for that to be activated. And then once that plasminogen is activated, then it's going to go to plasmid. Then then it's going to go through degradations. And once it goes to plasmid, then the plasmid is going to connect with the plasmid inhibitor, which is going to stop and is going to tear down more of the platelets. And this what happens because this tPA is this powerful kinase that the doctors use to calm down the stroke. And this is a tPA molecular structure. I just wanted to show you this. Basically, it kind of looks like beta alpha helices, and you can see all the sites like the disulfide bonds. They have the growth factor. You see all the domains and the active sites regarding this molecule structure. And then, it's basically, this is like another diagram I just want to show you. See how it goes to plasmin? That plasminogen on the fibrin goes straight to plasmin, and that plasmin is going to make that degradation. That's what's main thing. Once that plasminogen goes to the plasma, it's going to make that degradation for the blood platelets. And see, the process occurs when tPA binding with endothelial cells, and it'll be activated to plasmid, and then the fibrinolysis will be promoted, and the blood clot formation will be prevented. So the fibrin is going to make sure the blood clot is prevented. So moving on. And this is basically the last slide, and this is basically talking about the safety and the precautions and the results of people taking Altiplace and tPA over the years. And like I said, how I said earlier, it mostly affected when utilized within the first 3 to 4 hours after the stroke. And then, the NINDS, which is the National Institute of Health, basically. It's a branch of the National Institutes of Health. They conduct results that shows the patient treated with the tPA right after having the stroke within a few hours will have minor and will not have that much disabilities, or basically the aftermath, it won't be as bad, honestly, with the help of the tPA, because the tPA is tearing down that blood clot, which is going to allow that blood to flow properly again. And this is the last part of my slide. Thank you so much for joining with me. I hope y'all have learned something today, and I'll see you soon.